So, hello everyone. The topic for today, which we are going to discuss, is breastfeeding. So, breastfeeding is a word which is not only a word but it is a bond between a newborn and a mother. It is also a feeling which tells about the bond between a mother and a child. So, we'll just look into the aspect of breastfeeding. So, breastfeeding is a crucially important but increasingly a challenge in a market driven world. A newborn has only three demands. They are warmth in the arms of its mother, food from her breast, and the security in the knowledge of her presence. Breastfeeding satisfied all three. So this is a very famous quote by one of the person who named Grantley Dickering. So now another question: why breastfeeding is important? So if we look on the statistics, globally only 41% of infants are exclusively breastfed, whereas according to WHO, at least 90 to 95% infants should get this breastfeeding only. In India, only 46.4% of children under 6 months are exclusively breastfed, and that is a very poor data. So, like 100% of the baby, 100% children below the age of 6 months should be breastfed only. So now if we talk about the breastfeeding, there are two hormones. So always remember these two hormones when we talk about breastfeeding practices. So one hormone is prolactin and other hormone is known as oxytocin. So here we can see the reflex of prolactin. So as the name is telling prolactin, always remember with prolactin and production. So these pro is common. So you can remember with this trick, that is prolactin is responsible for production. So prolactin is, this is a hormone which is secreted by the pituitary. So when the baby sucks the nipple of the mother, what happens? It will send an impulse from the nipples. The sense of an impulse is sent to the brain, and from brain a hormone which is known as prolactin, it is released. When the prolactin is released in the blood, what will happen? It will help in the production of milk. More prolactin is secreted at the night time, and it helps in the suppression of ovulation. So this is one of the reason why the mothers who are breastfeeding the child for exclusively for 6 months, they are having a very less risk of getting pregnancy during those 6 months, because this will suppresses the ovulation. So oxytocin reflex. Oxytocin is the hormone which is responsible for the milk output. So here we can see, again you can remember with oxytocin and output. So always remember prolactin is responsible for production, whereas oxytocin is responsible for output. So here again you can see, when the milk is getting produced, now this milk has to be thrown out of the breast. So it has to be come out from the breast. So the hormone which is responsible for this is oxytocin. So here you can see in this blood, in this diagram, when the baby sucks from the nipple, what happened? Again, this will sense a impulse. The impulse is sent from the nipples to the brain in the pituitary part of the brain, and that part will release a hormone which is known as oxytocin. So this oxytocin will start releasing in the blood, and this will help in the uterus to get contract. This will happen works before or during a feed to make the milk flow. So this is the mainly production of the milk. Once the milk produced, now with the help of oxytocin hormone, the milk will get output. Now comes your oxytocin reflex, also known as milk output. So these are stimulated by or inhibited by. These are the factors by which the milk output increases. That means thinking lovingly of the baby, sound of the baby, sometimes the cry of the baby, or the sight or confidence of the baby. But the milk output is inhibited by the worry. If the mother is in worry or in a stress or in a pain or in a doubt, so obviously the milk production will decreases. So breastfeeding is easier. According to the World Health Organization, breastfeeding is very easier, but when you start learning about it before your baby is born. So obviously at the time of antenatal only, all the mothers, I must say not only the mothers but both the parents, they must be taught about breastfeeding during the antenatal time only. So these are some of the benefits which the infant as well as the mother, both of them will getting, and these benefits are both, like it can be a short term and a long term benefit. So quickly we'll see in this diagram. It will help and improve the infant gut health. If the baby is just only on the breastfeed, it will automatically improve the gut health. It improves the appetite regulation. It reduces the risk of developing non-communicable disease like diabetes, hypertension, any sort of cardiovascular diseases in the future health. So if the baby has taken a good amount of breastfeed for a good amount of years, you can say like up to 2 to 3 years, the chances of these kind of diseases will reduce almost by half. There are very few dental malocclusions if the baby is on breastfeed. Reduction in the infant mortality rate due to infectious diseases. So because the breastfeed provides immunity, so the child who got breastfeed, they have a higher immunity power as compared to the baby who is on the top feed or on the bottle feed. Then there is a reduced risk of infection that like GI infection, respiratory infection, ear infection, and so on. There is a reduced risk of overweight and obesity in childhood and later in life. So this is also one of the very major aspects. If the baby is breastfed till the child or age of 2 to 3 years, there are chances of less chances of overweight or obesity. And also the baby is of more IQ, that is improved intelligence, and the baby will be more sharp and more, you can say, the brain development is more stronger as compared to a baby who is a top feed baby. These are some of the most common breastfeeding problem if we talk about. So first is sore nipple. As everybody knows about what is sore nipple. So the breast engorgement, if the milk is not able to come out, so the milk is get accumulated in one or the two breasts, and this is a very painful condition where the mother may have this engorgement. There can be plugged milk duct again if the baby is not able to suck it out, or because of poor personal hygiene it may be happen. There can be low breast milk supply. This is also one of the reason of breastfeeding problem. Or there can be overabundant supply of milk, and mother is not able to, we can say mother is not able to give that whole amount of milk to the baby. So these are some of the common breastfeeding problems. There are certain breastfeeding solutions also. So quickly we'll talk about the problem and the solution. One is latching pain. Sometimes the mothers are complaining of latching pain. So the solution of this is have baby's mouth cover, or like whenever the baby is taking the breastfeeding, make sure that the whole areola part, it should be inside the mouth of the baby. Not only the nipple but the whole areola part, it should be inside the mouth of the baby. There can be a clogged or a plugged duct. So the easiest way to get rid of this kind of problem is you just need to apply a warm compress, and please make sure that mother is maintaining the personal hygiene. Mother can give a warm massage, apply a warm compress, and do a good massage, and this problem can be resolved. Mastitis can be one of the problem. So for this, because it is an infection in the breast, inflammation in the breast, so for this problem mastitis, mother should take antibiotic from the prescription of a doctor. Low milk supply. So this can be one of the problem, and because in the nowadays, because of recent advancement, we have breast pumps, we have breast milk stations also. Nowadays we have lots of availability of breast milk. So this problem can be solved by using any of those devices. Inverted nipples. For this, either the mother can use a pump, or the mother can be taught some of the methods by which the nipple can be protrude out, so that the baby can suck the nipple properly. There can be a cracked nipple. So the cracked nipple can also be treated with the help of the breast milk only. Engorgement can be there. Again, for engorgement, the massage can work, a hot fermentation can work, thrush can be there. Thrush is a problem where you need to take an antifungal treatment from the doctor only. Baby sleeping at breast, so that is also like one of the things. So start nursing baby on the fuller breast for more efficiency, and stimulate baby by tickling the feet or burping. That can be done. Or there can be painful letdown. Sometimes this may also happen. So this can be due to any sort of infection also. So this must be treated as soon as possible. Now quickly we'll see the 10 steps of breast successful breastfeeding. So the first thing is hospital policy. Like nowadays hospitals are promoting breastfeeding, so every hospital has a policy, every hospital has a room. And suppose if the mother is a breastfeeding mother, so every hospital having their policy related to 100% of breastfeeding to a newborn. Then staff competency, to staff who are working in the hospital setup, especially the staff who is working in labor room, or you can say the floor where the mothers are get shifted. They must be competent, they must be trained enough, all the doctors must be trained enough, so that they can just advise the mother as well as father about the breastfeeding, the importance of breastfeeding and how to do it. Antenatal care is another important aspect. As I already told you in my previous slides only, that preparation starts only from the antenatal time, so it has to be taken care very promptly, I must say. And care right after birth, that is again important, because what happened when the mothers are not getting a right care, she was in a pain, so mother is not able to provide the breastfeed. So right amount of care immediately after the birth is very, very important. Another thing is support mother with breastfeeding, because mothers are not that much competent, and especially when the mothers are primary mothers. So please support mothers with breastfeeding. Supplementing is also important. Some of the hospitals are they are giving breast milk unless they are medically medical reasons, and so it is important to give the supplementing breastfeeding also. Rooming in is another important thing. Rooming in is when we are keeping the mother and child together, so this is again important thing. Keep both of them together so as to avoid any kind of problem. Because it will create a good bond between both of them, and it will help in good breastfeeding. Then comes your responsive feeding. So responsive feeding is nothing but it is helping mother to know when their baby is hungry. So because some books are telling every 2 hours we need to feed the child, or SOS we need to feed the child, but this should be a internal feeling of a mother. Then whenever the baby is hungry, mother must have to feed the child, whether it's in the midnight or whether it's in the early hour of the morning. Bottle, teats and pacifiers. So these are a big no, because these are the things most commonly we are giving to the children. And especially if the mothers are, because now the mothers are working, so we are giving these pacifiers or the bottle feed or the teats, but they are a high source of infection. So please try to avoid these kind of things to the infants. And the last thing is discharges. So the hospital support mothers to breastfeed. Discharges is very, very important. At the time of discharge, please tell about all the do's and don'ts regarding to breastfeeding. Tell about the problems that can be that can about to come in the future, and how to overcome those problems. So tell everything in detail, not only to the mother but to the father as well as to the extended family also, so that everybody can help them out. So this is all about breastfeeding. So yes, this is the breastfeeding video. So if you have any doubt, you can just put it in comment section. Thank you.